Okay, so these are the stages. If you look at the rhetoric, we have said that addiction is a chronic disorder since 1794. But we really haven't believed it because we pretty much treated addiction like it was a broken arm or a bacterial infection. And we've done it through, well, first let's look for some evidence. If we look at how does addiction compare to other chronic diseases, this is the work of Tom McClellan and others. Classic article in 2001 in the Journal of the American Medical Association, where they really said, look, here's the data on addiction, and here's the data on diabetes and hypertension and asthma. What do we find both in terms of compliance rates? Compliance with diet, compliance with education, compliance with exercise, whatever the recovery management recommendations are, we see that the compliance rates are about the same. We see the relapse rates are just about the same as these other disorders. We see these disorders are influenced by multiple risk factors. They're all influenced by voluntary choices. Agreed? Diet, exercise, medication compliance, all these involve issues of choices and how well I do. They have a prolonged course, and that course tends to vary from person to person. Here's some data for you. We looked at a sample of 1,271 treatment admissions, consecutive admissions, so it's a random sample, and we said this. What is the length of time from the first onset of use to the first year of abstinence for people who met DSM-4 criteria for dependence? And what do we find? How long are we talking about? Decades. Look at the midpoint. We're out here 25 years. Let's look at, this is another one where we looked not at use, but we looked at problems. So there's a long use period that may predate this, but if we said problems began here, how long between the first problem and the first year of continuous sobriety? And what do we got here? The median on this one is 12 years average. You want to talk about a prolonged addiction career? We looked at this one from when did treatment start to when the average time for the first year of continuous sobriety. And in this one, the average was 9 years, and inside that box over there, it says an average of 3 to 4 treatment episodes. All of these disorders are accompanied by risk of profound pathophysiology, disability, premature death. They all have effective treatments. You know, we can management protocol, but no known cures. That's pretty much what these look like. What we're saying to kind of introduce this shift we're about to make is if we really believed addiction is a chronic disorder, there are some things we simply wouldn't do. We would not create the expectation that full recovery should be achieved by everyone from a single episode of addiction treatment. And that if that doesn't occur, that it's a personal failure of that individual. Number two, we would not view prior treatment as a prognosis, poor prognosis, and also grounds to fail to admit this person. In fact, in the acute care model, if somebody's been treated at a facility before, we increase the probability they'll refuse admission of this person. So let me get this straight. The person who would actually know this person best is now refusing to admit this person because they no longer have anything to offer them. Number three, we would not exclude clients for confirming their diagnosis. I just got to talk about this one for a second. You know, as a historian, I can tell you horror stories in addiction treatment. I can tell you of times we prescribed pounds of cocaine hydrochloride for the treatment of morphine addiction. And I can talk about mandatory sterilizations to treat alcoholism, and prefrontal lobotomies, and shock therapies, and every kind of drug insult imaginable. And you look back on those and you think, what the hell were they thinking back there? But you know, history's a humbler. Because, you know, you're obsessed with, as a historian, with, I wonder what they're going to say about us later. You know, if you jump out about 50 years and they look back, and what are they going to be saying? What the hell were those people back there in 2009 thinking about? Well, here's one, I promise you. I want you to look at this very objectively, as we would any illness. We admit someone for a disorder of addiction or substance dependency or a substance use disorder on the grounds that they have a disease. And the essence of that disease is one of two things. One, an inability to abstain from using alcohol and other drugs in spite of escalating consequences. Or once a person begins use, they don't have a consistent shut-off valve. Are you with me? They can choose to start, they can't choose when to stop. So this person comes at our facility and they tell us they have this. And based on their verbal report and that of their family, we admit them. And 24 hours later, we find they have consumed alcohol or other drugs as an outpatient, through a drug test, or in our facility, meaning they have confirmed, they become symptomatic. They presented the actual symptom of the disorder for which they were just admitted. And as a result of confirming that they really do need to be with us, we administratively, or even worse, therapeutically discharge them from addiction treatment. Is there any other healthcare arena where you can get thrown out of a hospital or a doctor's office for getting symptomatic while you're there? You know what? History is going to judge us very harshly for this. Now, I'm going to be the first to admit, there are days people can be out of control in terms of their behavior. So they're not appropriate for a particular level of care. If I'm on a routine medical surgical floor, right, and all of a sudden I'm having a heart attack, I shouldn't be on that floor. I mean, I've clinically deteriorated and they're going to move me to ICU. But they're not going to throw me out of the hospital for failing to cooperate with them. And my point is that the issue isn't just that somebody got symptomatic and we needed to move them from res rehab to detox to restabilize them. But when we sever the relationship with them and punish them as if this was a moral choice on their part, history's going to be mean and ugly with us on this one. Number 4. We would not treat addiction in serial episodes of disconnected treatment. We would not relegate aftercare to an afterthought. Most importantly, we wouldn't terminate a service relationship following brief intervention.